We truly are seeing the sickest of the sick kids. And I think that just makes for a very concentrated experience for both fellows and any other trainees that go through our program.
As a fellow, you'll have the opportunity to care for the same patients that you would at any other PICU training program, along with patients that you probably wouldn't have the opportunity to care for elsewhere. Hershey itself is more of a rural suburban location, but we're right next to Harrisburg. We're a level 1 trauma center, so we get all of the typical trauma patients that you would in a big city. Based on our location, we care for a lot of somewhat more rare traumas like farm accidents. The fellows here have a ton of exposure to procedures. We do a lot of intubations, a lot of central lines, a lot of arterial lines. We do our own chest tubes, we do our own peritoneal drains, and there are enough procedures that I don't think our fellows ever feel like they're having to wait their turn or compete with other people to get that procedural experience.
The simulation allows our fellows to not only practice the resuscitation skills, but also to truly practice leadership and coming into a room and taking over the room and helping get the patient the care that they need.
I loved every aspect of the PICU. Everybody was really nice to me, very welcoming. I saw a great number of cases, much higher acuity than I would expect at an 18-bed unit. We have a great group of people to work over here with.
I think one of the strengths of our program is that we have faculty that's come from a lot of different centers and they know a lot of different ways to do a lot of different things. They're teaching me and they're teaching us strategies to be able to succeed anywhere.
We all have a sense of exactly where each fellow is in their journey to becoming experts in critical care. We have a sense of kind of which fellow needs maybe potentially help with one procedure versus another, and that allows us to truly make sure that those fellows are getting the personalized instruction that they need.